Medicare Advantage versus Medigap. That has to be the number one question that we receive at my office. In an absolutely perfect world, I would 100% recommend a Medicare supplement to anyone and everyone that can afford it. My name is Mark Prip. I'm the owner of Policy Guide. We basically educate Medicare beneficiaries throughout the country, so I wanted to shoot this video on this popular topic to help you understand when you are new to Medicare or thinking of changing plans. I wanted to give you my feedback on over almost 15 years in the Medicare space on the difference between these two plans. Okay, so let's just jump right in. The very first thing I'm going to talk about is the pros and cons of Medicare Advantage plans. And then I'm going to go through the pros and cons of Medigap or Medicare Supplement, and then I'm going to go through the benefits and the cost. And I'm going to try to do it in a condensed version to give you the most value. So right out of the gate, let's talk about the pros and cons of Medicare Advantage plans. So the pros, Medicare Advantage plans have substantially lower or even no monthly premium. Yes, you heard me right. Low or no monthly premium. Most plans include prescription RX coverage all in one plan. Most Medicare Advantage plans will also try to offer things like extras like gym memberships, maybe dental and vision discounts, whereas a Medigap plan does not. The cons of a Medicare Advantage plan would be they have significantly higher out-of-pocket costs per calendar year, and in 2024 that amount is capped per CMS guidelines all the way up at $8,850. Medicare Advantage plans do experience annual plan changes. Providers, doctors, and hospitals can be dropped out of the network or leave the plan on their own. Certain, if not many, procedures require prior authorizations. Network restrictions when traveling, especially if you have an HMO. PPO is going to give you in and out of network. HMO requires you to remain in the network unless it is for an emergency. Now, moving on to the Medigap pros and cons. In comparison to Medicare Advantage, one of the biggest, and I mean biggest, pro to a Medigap plan is they do not have prior authorizations. You also have complete network freedom. You can go anywhere Original Medicare is accepted in the country. No referrals are required. There are virtually no annual plan changes. I say virtually no plan changes. We recently saw some changes on Medigap Plan F, but year over year, the benefits on Medicare supplement plans remain the same. They have significantly lower out-of-pocket cost compared to a Medicare Advantage plan. Freedom to travel, as I mentioned before. The downsides in comparison is that they can cost as much as $150 per month. And they also require a separate prescription drug plan. Now, let me show you some of the benefits and the difference between the two. A Medicare Advantage plan is going to have copays or coinsurance for all services. So let me give you an example. Let's say you go to the doctor. Your plan may have a $0 copay for a primary care, or it may have a $50 copay for a primary care. Specialist may be $50 per copay per visit or $75 copay per visit. Things like outpatient testing and surgery, chemotherapy, those things may have a copay or they may require you to pay 20%. As I mentioned earlier, the higher out-of-pocket costs up to $88.50 in 2024. Think about a Medicare Advantage plan like a employer-based or group health benefit plan that you had in the past. So you pay a monthly premium, and at time of service you're paying a copay or a co-insurance, as I mentioned before. So that the Medicare Advantage looks and feels like a group health insurance plan, whereas a Medigap plan looks very different from that. Now, Medicare Advantage plans, I mentioned before, some of them will include optional gym memberships. Most of them include prescription drugs, and dental plans are often included. However, they're usually just discount plans. Now, on a Medicare supplement benefit, you have no copays. Okay, so if you go to the doctor, you do not have a copay. If you go to a specialist, you do not have a copay. You have no copays after that Part B deductible. So each calendar year, you pay that Part B deductible, and then everything is covered 100%. So that is significantly different than a Medicare Advantage plan where you're paying copay every time you go. So they're far superior to Advantage, and let me explain to you why. They have significantly lower out-of-pocket costs for medical care and treatment. Because Medicare Part A and B are your primary, the supplement is going to come in and pay any remaining balances. So Medicare generally pays 80%, the supplement pays the 20%. So if you go to the doctor between original Medicare and the supplement, you shouldn't pay anything after your Part B deductible. If you go to the emergency room, if you go to the hospital, if you have testing, if you have surgery, if you have chemotherapy, any kind of medical care that is approved and covered by original Medicare, the Medigap or Medicare supplement picks up the balance. There are also no network limits. I repeat, no network limits. So if you call our office and say, hey, I want a Medicare supplement, can you check that my doctors and hospitals are in the plan? We're going to just say, yeah, they are. Because there are no network providers, there are no provider directories, there's no portal on a website to search. You simply go wherever original Medicare is accepted. Now, getting into the cost of each, let's take a look at that. Now, as I mentioned earlier, the average price is about $150 a month, although premiums vary from plan to plan and company to company. And let me expound a little bit. I'm in Florida, and we service 40 states. So the price for a Medigap Plan G in Florida right now, maybe for a 65-year-old, maybe $205 a month. That same 65-year-old in the state of Iowa or Indiana, maybe $115 a month as an example. So Florida is quite a bit more expensive than other areas of the country. But that gives you a general idea of the premium for most Medicare supplement plans, and I'm always going to refer to Plan G because that's the most popular plan today. Now, on a Medicare Advantage plan, the monthly cost, this information is pulled directly from a report done by the Kaiser Family Foundation. I've linked to it in the description below. But basically, they did a study, and this is in 2023. 73% of enrollees in individual Medicare Advantage plans with prescription drug coverage pay no premium other than the Medicare Part B premium. Your monthly cost for a Medicare Advantage plan, you have a 73% chance of that being zero depending where you are. The remaining 27%, depending where you are in the country, you may have a premium. It could be $10 a month, it could be $100 a month, just depending on the plan and the county you're located in. So my final thoughts are this. One of the greatest differences that most agents will not tell you is that a Medicare Advantage plan requires prior authorizations. Medigap or Medicare Supplement plan does not. And what that means is, let me give you a quick example. You're in the hospital, you have chest pain, they're trying to figure out what's going on. Depending on what that doctor orders, a Medicare Advantage plan could deny that test or require prior authorization that may take hours or days for the insurance company to approve. Prior authorization always equals delayed care. I repeat, delayed care. Medigap and Medicare supplement plans do not work that way. Medicare, original Medicare is the primary payer. The Medigap plan is the secondary. So in that same scenario, you should experience no delays and no prior authorizations for that example. A Medicare Advantage plan is like a car you pay cash for, Okay, so you go out, you find a used car, you're going to pay $4,000 for it. So you do not have a monthly car payment. Yes, your monthly payment is none because you own the car outright. But every time that car breaks down or needs service, you're going to pay a percentage or a copay every time that car needs repair or service. You need tires, you need an oil change, your engine explodes, your transmission goes out. Anything that happens, you're fully responsible for a copay or a percentage of those car bills, so to speak. Now, a Medigap plan or a Medicare supplement plan, in my opinion, is like a brand new car that you drive off the lot. It's brand new, it has a monthly premium or a car payment, but every time that car has problems, you don't pay anything at all except for that small Part B deductible. The Medigap plan is far superior. You can take it to any service shop you want to. It'll pay to have your tires replaced, it'll pay for oil changes, it'll pay for engine repairs, it'll pay for transmission repairs, all at 100%. You have to decide based on your health history and your current state of your finances. What I tell people is we can't predict the future. And a lot of people say, well, I'll just jump on a Medicare Advantage plan because it's free or zero premium. And then I'll worry about, I'll just hope that I do okay and I don't have any major medical problems. And that's an idea, but if you get on a Medicare Advantage plan and something changes in your health, there's a possibility that you then become ineligible for the Medigap plan if you've been on that Advantage plan for more than 12 months. So a Medicare Advantage plan has upwards of 7 moving parts. With Medigap, you pay your premium, that's it. It's set it and forget it. The only reviews that we ever do with Medigap clients is literally to look at, hey, do we have another company that offers a lower premium for what we put you on a year ago or 5 years ago, and you love the plan, you just want to reduce the monthly premium. So literally that's really all of the review we do on Medigap is simply the monthly premium. Both of my parents have Medicare supplements, both of my in-laws have Medicare supplements, and they are very tempted by the Medicare Advantage. And every year I say, don't do a thing. If you can afford your Medicare supplement premium, pay that. And they've been very grateful because they've used it very, very much. So again, you have to decide which is the best for you. I highly recommend Medigap or Medicare supplement if it's in the budget. Thanks for watching. If you have questions, give us a call, comment, shoot us an email. Thanks.